Hello, my name's Joanne. I'm a physiotherapist at the Hillingdon Hospital Trust. We're going to talk to you today about our BFABB programme. So BFABB stands for Best Evidence for a Better Back. We have developed this on the back of the new NICE guidelines. So NICE issued guidelines on the management of back pain in 2016 after reviewing all the evidence. So far we've been running this programme for a year. We've had a lot of positive feedback from patients. We've had 94% patient satisfaction, 54% have rated their experience 10 out of 10. We've been published on the NICE website for implementing the programme. We've also had an article published in Frontline, which is the Chartered Society of Physiotherapists magazine. We've had very positive feedback from patients who've said things like it's very informative, excellent advice, explanation about back pain was excellent, and it answered many of my questions. So today we're going to be here for about an hour and a half. We're going to have a short presentation, which is what we're watching at the moment, with an opportunity for some questions, followed by an interview with a physiotherapist one-to-one. When you were invited to our BFABB programme, you were sent out 3 forms. So one form is a medical screening form, which tells us about you, your back pain and your medical history. The second paper is a short questionnaire with 9 questions that tell us about your feelings about your back pain. And the third one was a questionnaire that we have to use to see if we're making a change, we're making improvements with the treatment. We thought it might be a nice opportunity to explain to you a little bit about the anatomy of the back and the spine. So this is the spine. This is the front of the spine. This is the top, my skull, and this is the bottom, the pelvis. So the spine is made up of 24 bones. These bones are called vertebrae. In between the bones are the discs. Now the discs are like little sacs of fluid. When we're young, they're very hydrated and they act as shock absorbers. As we get older, they tend to dehydrate a little bit. With these discs, you can see that they hold the bones apart and they form these little holes for the nerves. So the nerves from the neck will supply my arms. The nerves from the lower back will supply the legs. Inside is our spinal cord. So one of the main functions of the skeleton is to protect our organs. So the skull protects my brain and the ribs protect the lungs, as the spine protects our spinal cord. And the really important thing that we'd really like to get across is how strong the spine is. It's one of the strongest structures in the body. So as an example, between each one of these bones, there is a ligament. Then there is another layer that goes across 2 sets of bones. And then there is another layer across 3. And then you have the same configuration of muscles over the top. So the most important thing is that the spine is strong, it's flexible. It's meant for bending, lifting, twisting. Some of the common questions we get from patients when they come to see us are, well, why me? What's causing my back pain? Is it something I did? Actually, up to 80% of people will experience back pain at some point during their lives. The cost of back pain is £1.3 million a day to the NHS. The cost to the economy is about £3 billion a year in managing back pain. So it is a big problem. Will I get better? Well, actually, 90% of acute episodes will normally get better within about 6 weeks. And that's with the appropriate management, which is what we want to try and educate you on today. A lot of people get very anxious with their back pain and they will ask us, well, why am I not being referred for tests or scans? Clearly, if my pain isn't getting better, is there something wrong? Well, actually, we tend not to use scans these days. There are a lot of back pains. 95% of back pains are diagnosed as non-specific after having scans. Only a very, very small percent, less than 5% of back pains are a serious pathology. So just as an example for that we often get misleading information from scans, we have this piece of evidence from Jarvik et al. That took 148 people without any back pain. 91% following scans were shown to have moderate to severe degeneration. 64% were shown to have one or more disc bulge. However, these patients were not experiencing back pain at the time of the scans, which is why we tend to avoid using them as a full diagnosis. Patients ask us all the time, well, why do I get pain? What about my pain? Well, we get pain. Pain, as we know, is our body's defense mechanism. So pain will warn us of danger. If we fall off the curb and twist our ankle, that pain tends to protect us from doing any further damage at that point in time. What pain doesn't do is report the actual amount of damage. So there are some people who will experience very high levels of pain with very little damage. Others may have very low pain, but a lot of damage. Pain, we tend to go through normal healing if we have an incident where we've tripped off the curb. However, over a period of time, if we don't get that normal healing, pain can actually change. The messages to the brain can actually change, and we can perceive pain differently. We can perceive old injuries can come back and show us that they're becoming painful again, and we can lose sight of where that pain is coming from. Unfortunately, what this means is poor management of an injury, and then we can get ongoing problems with that. There is a very good website and a video that can be watched called Tame the Beast, and all these links are on our website for you to follow through. When you've had treatment with physiotherapists, we commonly would advise on posture in the management of low back pain, feeling that if we can improve postures, it will help your back pain. However, there is unclear evidence on what really is the best posture. What we do now know is it's the length of time in positions that can be a contributor to your back pain. There is some strong evidence that there's actually no association between these awkward postures and low back pain. A piece of evidence showed us that office workers who were required to sit for long hours in front of a computer, that wasn't actually a contributor or an association of their risk of back pain. If you do need to move at this point in time, if you're sat watching this, then please do, because we don't want to be in these positions for too long a period. What do we now know about back pain? Well, as we talked about earlier, NICE is the National Institute of Clinical Excellence, and they have issued new guidelines on managing back pain. And this is what we'd like to then show to you. So some of the common treatments that you've seen or may have had are things like mobilizations, massages, tractions, exercise, acupuncture. And a lot of these are things that we as physiotherapists may have done. But the guidelines looked at a lot of these treatment options. And things such as acupuncture, well, actually, there was no clear evidence of any long-term benefit for acupuncture, so it tends not to be encouraged as a form of management now. Injections, again, you may have heard of injections. There are various kinds of injections that we can have to help manage the pain. Again, this is also being discouraged because there's no evidence that this produces long-term benefits over and above other options. Surgeries. So a non-surgical approach is obviously what we would like to promote first, because we don't want those excess risks of time in hospital, infections, DVTs, and more time off work. And evidence has shown that actually things like exercise are as effective as surgery in the treatment of low back pain in that long term. Medications for back pain. So the NICE guidelines now are saying that we're not to offer paracetamol on its own for management of low back pain. So this is something that if you're struggling to manage your pain, then you need to go and have the conversation with your doctor. And they will know your current medical history, any current medications, and they will be able to manage that with you. So, other treatment options, well, exercise came out as one of the treatment options that appeared to be successful in managing back pain. Why is it so important? Well, what we now know is exercise helps us to reduce low back pain and disability in the long term. So for instance, a piece of evidence done by Gordon et al. Showed that the pain was reduced by 52% in patients and their disability reduced by 27% following an exercise program. We also know that exercise has actually shown to help us reduce the recurrent episodes of back pain. And we know that staying as active as possible and returning to levels of activity as quickly as you can after these acute episodes is beneficial in managing that return to normal life. So, well, why isn't it a good idea just to stay in bed? Well, what we do now know is that bed rest tends to lead to greater levels of pain, greater disability, longer time off work, and obviously that general weakening. So again, that's something that we would discourage now. A lot of people want to know, well, what's the best exercise for my back pain? Actually, what really is good to hear is that any exercise that you enjoy. So it's really about trying to make it easy access for you. If it's something that you can include into your day, either a walk to work or something that you really enjoy, you're far more likely to stick to it than something that you're not going to enjoy. And the exercise that we now know, some of the research has looked at exercise, but actually it's not been specific forms of exercise. It can be high intensity, low intensity, strength training, or flexibility training. Why do you sometimes feel pain though after exercise? Well, soreness after exercise doesn't necessarily mean greater amounts of damage. There is a phenomenon called delayed onset muscle soreness. And this is where the body reacts to doing something that it's not used to. And it's a perfectly normal thing, whether it be that you've been sweeping the leaves or you've gone out and run a marathon. If your body's not used to it, you will have to slowly build up to those levels of activities. How much exercise should I do? Well, the World Health Organization, the American College of Sports Medicine, NHS England, have all supported that we need to now be looking at doing 150 minutes of exercise per week. So that's moderate activity levels. That works out at about 30 minutes on 5 days a week. Now, if you were doing a higher intensity exercise, that can be 75 minutes a week. And the exercise doesn't need to be hot, sweaty for that 30 minutes. It can be bouts of 10 minutes, just getting your heart rate moving that body. When do I need to seek help? Well, there are some serious conditions with our back pain that we need to be aware of. They are very, very rare. You may have been asked and you may have come across some slightly strange questions, but if you were to experience any change in your symptoms that may involve any numbness around your saddle area, your inner thighs, then this may be of a concern. Any pins and needles or numbness that you're not feeling if you're washing or cleaning or wiping yourself. If you experience changes in your bladder and bowel function, so things that you may not be aware that you need to empty your bladder, or you may not be able to control your bowels, or you may be experiencing other leakage or other changes. These are also concerns, and they're something that you need to be taking yourself to hospital. Go to your local A&E department to explain these findings. It may or may not require further treatment, but it is far more appropriate to have it checked out than to carry on and do nothing about it. There are some other conditions as well, such as a dramatic increase in your pain that does not settle throughout the day or the night. If that's associated with things such as any sudden unexplained weight loss and things like that, then again, these are obviously concerns that should be either discussed with your doctor immediately or discussed with an A&E department if you feel there's anything else associated with that. So just to summarise, well, what do we now know? We now know that exercise is really beneficial in helping back pain. It can help to reduce the recurrent episodes of back pain, and it can help in preventing those recurrent episodes and aiding the recovery. What we do need to know is that we move with confidence in a nice relaxed manner to avoid muscle guarding. We need to do exercises that we enjoy, because all exercises is deemed safe. And we're wanting to aim to try and do that 150 minutes a week. Don't take prolonged rest, as we know this is detrimental to that recovery. And remember that things like soreness, muscle soreness, pain after starting a new exercise is normal. And please bear in mind that exercise in the long term is as effective as many of the other treatments for low back pain. We have a website. It's called the Hillingdon MSK website, www.hillingdonmsk.com. On that website, we have a link to all the resources that we've used in presenting this video. There are some very useful videos to watch through the website and other information such as the NICE guidelines.